I work on two things. I only do screen sharing. The idea occupied you, doctors. You started? Okay, okay. What's the problem? The idea is that they began to see. The idea that the best they started to see, do ultrasound pulses have an effect? Or do ultrasound beam D have an effect? Or is there really no effect? And as I mentioned, there is no evidence of a clear effect from ultrasound pulses, but in reality, the topic is starting to be studied. You may have heard about HIFU, which is high intensity focused ultrasound, and its use is now in treatment procedures for tumors by focusing the beams with ultrasound, of course, at high power and with a specific technique. This means that it can concentrate the ultrasound to start raising the temperature of the tumor cells and reach a point called cytotoxic temperature, at which the cells begin to rupture or suffer cell damage, leading to the death of the tumor cells. This is the HIFU technique, or high intensity focused ultrasound, that is currently available. This uses high power and operates at high power, meaning high intensity focused ultrasound pulses, and it focuses significantly to raise the temperature of the tissues. As we know, our temperature range is between 36 to 39 degrees. There can be an increase in temperature in the tissues as a result of ultrasound pulses. The ultrasound pulses compress the particles present in the tissues, which leads to this compression effect. Energy transfer occurs, which can lead to an increase in the temperature of the tissues present. These tissues begin to transfer their heat, similar to what we discussed before regarding the X-ray tube, where heat transfer happens within the anode itself to the other parts of the X-ray tube. This occurs through heat conduction. The same idea applies to tissues, where adjacent tissues transfer heat through blood flow, which carries this heat or energy to other parts of the body. This effect is indicated by a specific value known as the thermal index. In ultrasound, for example, you will see two parameters, one called thermal index and another called mechanical index. The thermal index indicates the heat increase and whether the power you are using for the ultrasound is appropriate. The heat delivered will raise the temperature of the tissues by a certain amount, slightly creating what is known as the thermal index, which is a ratio between two things: the power of the transducer itself and the power that can raise the temperature by 1 degree Celsius. If, for example, this value is 2, it means that you will increase the temperature by 2 degrees, because when you divide the power output by the power that raises it by 1 degree Celsius, your thermal index is the ratio between these two powers. In this case, if the value is 2, it indicates a probability of slightly raising the temperature by 2 degrees Celsius. The thermal index has been assigned values, slightly indicating that you should be cautious during the imaging process. He also started to tell you that this topic depends on the exposure time. If you increase the exposure time or the imaging duration, then the heat effect will increase for you. If the tissue itself has a high absorption coefficient and absorbs ultrasound effectively, then there will be a significant loss of energy, leading to high heating. So, the absorption coefficient is crucial. The type of tissue you are working on, as well as the frequency, as we discussed earlier, can significantly affect the results. It determines what you are working on, which becomes apparent during the imaging process. The tissue itself or the origin. For example, if you are talking about neonatal or fetal tissues, will have a higher sensitivity or response to heat compared to other individuals. Therefore, values for the thermal index are established, and we should adhere to these values. As I mentioned, the thermal index is a ratio between the power or the ultrasound power needed to achieve a 1 degree change in temperature. The thermal index, as I said, is necessary to raise the temperature by 1 degree. If I talk, for example, about reproductive cells like the unborn fetus and the central nervous system, then this will be more sensitive to the heating effect. The same idea applies if I talk about if the index is less than 0.5, this is considered a threefold safety level, or the user should consider this index safe for them. In some cases, it is mentioned that if the safe index is between 0 and 1, you will not exceed the index of 1 degree Celsius. In this case, this index is safe for you. In case you increase the thermal index, or if the thermal index is increased, it is said that to reduce this effect or decrease the probability, you should reduce the scan time. Most diagnostic procedures or ultrasound diagnostic procedures are usually in the range of less than 0.5 for you. Therefore, you should not raise the temperatures from those present, such as the embryo that is less than 8 weeks old after conception, or the head, brain, and spine areas of the fetus or the neonate, which are considered sensitive organs or sensitive tissues. They are highly sensitive tissues regarding the thermal effect or the effect of the ultrasound pulse or its heating effect. In fact, when you observe things during the thermal effect, there is something called the bone thermal index. The presence of bone is significant because it is considered a highly attenuating material for ultrasound pulses. Thus, the absorption of energy here becomes high, leading to maximum heat effects. The presence of bone affects the thermal index, which is why it tells you that you also have a thermal index for soft tissue. No, you have the soft tissue thermal index and the bone thermal index. And if the bone is on the surface, it creates what is called the cranial thermal index. All of these are values according to the imaging or the scanned organ that you are performing the imaging process on and the position of the bone in the OS imaging field. The energy that is absorbed during the process of heating or tissue heating depends on the absorption coefficient of the tissue as well as on the frequency and the intensity of the ultrasound pulse. Just like we were discussing, an increase in the absorption coefficient increases the energy absorption, which enhances the heating effect. Increasing the intensity will enhance the heating effect. As for what will happen, there is no evidence-based or confirmed evidence regarding the effect of ultrasound, but this is theoretical. According to the guidelines, specific guidelines are set for ultrasound safety, so we just follow these ultrasound guidelines regarding safety to prevent any effects on children or any individuals while we perform the procedure. The phenomenon known as the heating effect is significantly influenced by the specific type of tissue involved. This effect occurs when energy, often in the form of heat, is transferred to the tissue, causing its temperature to rise. Different tissues such as muscle, fat, or skin have varying capacities to absorb and retain. It talks about this, and of course the one that is less than 0.5. The second point is also regarding ultrasound safety. If we look here, we will find the value that is present. This is what has appeared for you. So, what is this talking about? If we think back together about the topic of harmonic imaging and discuss the subject of air bubbles or the bubbles present in contrast media, if you remember this story, we were saying that exposure to ultrasound pulses creates a type of resonance or causes compression and expansion regarding the air bubbles. And the same idea applies to the air bubbles present in the patient's body. They are exposed to this. And what happens is that, for example, when they are exposed, they start to undergo a process where they expand, and then compression occurs for the particles, leading to shrinkage and so on. This movement of the air bubbles is what we were talking about, which is the topic of resonance, or the fact that they produce frequency. I have a frequency that I use in the topic of tissue harmonic imaging. We use this in relation to contrast media, but here you have an effect that will appear, which is the idea that if you are using high power ultrasound, this high power ultrasound can cause the explosion of the air bubbles present and create something called cavitation. This topic depends on the power of the ultrasound itself that you are using, which starts to cause a growing in the size of the micro air bubbles present. As you can see here, the size of these bubbles increases with reflection, leading to expansion. When it reaches a certain limit, or if this negative pressure increases, I refer to this as positive pressure, and this as negative pressure. If negative pressure increases beyond a certain point, it will start to cause an explosion and create cavitation. Air bubbles can explode, and this phenomenon has an effect because it can initiate what is called the production of free radicals, which may later impact cell death or stimulate the process of apoptosis. This is a significant process in various scientific fields, as it can lead to important biological changes. This discussion is, of course, theoretical, meaning we are talking about high rarefaction or high negative pressure concerning the ultrasound beam you are using. Therefore, the mechanical index is considered the ratio between the pressure of this rarefaction or the negative pressure of the rarefaction, which is supposed to increase. Thus, the value of the mechanical index will increase, and so will the effect or the impact on the micro air bubbles will increase in number and size over time, which is a natural process. This increase is significant because it impacts the system's dynamics. Essentially, these tiny bubbles interact with their surroundings, leading to their growth and multiplication. Understanding this process is important for various applications, as it provides insights into system behavior under certain conditions. So, in this manner, the micro behaves as expected, okay? This is the relationship that links the mechanical index to the rarefaction pressure, which I mentioned depends on the square root of the frequency. Of course, the relationship here indicates that the mechanical index also has a value that must be monitored and followed. You should not exceed a certain value of your mechanical index to avoid creating high pressure on micro air bubbles. This issue can be somewhat sensitive if you are dealing with contrast agents that contain a large percentage of micro air bubbles and are injecting them into the bloodstream, or if you are dealing with gas bubbles, for example, in the lungs or intestines, where there are many micro air bubbles. This can be highly sensitive regarding the effects of cavitation or the effects of high pressure concerning ultrasound. It was stated that for general diagnostic ultrasound, the mechanical index must be less than 0.7, especially if you are using a contrast agent, especially if you are using the agent. It will consequently increase the occurrence of cavitation for you. So will micro air bubbles increase the risk of cavitation for you. Regarding the unit, the imaging should not exceed the 4.5 mechanical index. Slightly. Be careful with some values. Regarding the intensity of your ultrasound pulse, it should not exceed 100 milliwatts per centimeter square. The total sound energy should not exceed 50 joules per centimeter square. The thermal index indicates local heating, and as I mentioned, a maximum value of 0 to 1 is considered safe. For me, The mechanical index should not surpass 3 when dealing specifically with vital scanning situations, and it is recommended that it remains less than 0.7 for general use purposes, as well as being under a threshold of less than 0.5 for vital scanning scenarios in particular. If these limits are exceeded or surpassed beyond what is advised, it will lead to potentially harmful effects such as cavitation regarding contrast agents used in medical imaging procedures. So, concerning safety measures related to ultrasound technology usage, I have two important considerations. Namely, they are both the thermal index alongside also considering carefully monitoring of mechanical index values too. Both indices are interdependent. One increases significantly affecting turbulence effects while simultaneously impacting existing conditions along with influencing how much turbulence effect might increase further. It indicates precisely how much temperature will rise due directly from increased energy input into tissues during scanning sessions. For me, the mechanical index should be less than 0.7 for general use. When dealing with vital scanning, or reproductive cells, or fetal applications, the mechanical index should be reduced to greater than 0.7. If you are working with a contrast agent, you should keep in mind that the mechanical index should be less than the standard value of 0.7 and should not exceed 0.7. If you are dealing with contrast agents in micro air bubbles, when we talk about artifacts, the mechanical index should be less than the standard value of 3 and should not exceed it if you are working with a contrast agent via micro air bubbles. Well, if we talk about the surprises of the Earth, in fact, there is an artifact based on the word artifact. Initially, you are supposed to take the reflected pulse in art sound, start recording it, and categorize it according to its intensity, whether it is hyperequal, hypoequal, or unequal. After that, you say, well, this signal came to me from the specific location according to the speed of ultrasound is approximately 1540 in soft tissue. You know the average velocity and the distance. Now you received the signal, you recorded this signal and placed it in the wrong location. Or it is supposed to come to you with a certain level of intensity and there was attenuation in this intensity or strength, or this intensity had an error for any possible reason. This is considered an artifact or anomaly. If there is a word artifact, it means that you have a deviation or a problem or discrepancy that caused what reached you not to be seen at its true and accurate value. Don't you see it for its value, the truth? You don't see it for its true value, okay? There are artifacts related to attenuation and artifacts related to reflection regarding the reflection or the reflection specific to art sound. Let's first talk about the topic of attenuation. If you have a transducer like this, the transducer emits an ultrasound pulse and you have a strong attenuator. What does strong attenuator mean? It means a material like bone, calcium, or stones. What do these stones do? They cause attenuation of the ultrasound pulse, meaning they absorb a large amount of the incident ultrasound. So when absorption occurs, what happens? The transmitted signal that reaches the tissues or organs beneath the strong attenuator will be weak. Now, what's the problem when the intensity decreases? The reflected pulse coming from the tissues or from the areas behind the strong reflector will also be very weak, resulting in a signal or an area appearing black or dark in this way. There is a defect in this appearance, this area. No, that's it. I call it acoustic shadowing. What happened at this time? Why did the shadowing you see appear? Because in the simple area, I have the transducer here, and this area is supposed to be like the adjacent area, which has high intensity, because they are all at the same depth for me. But due to the presence of the stones here in the gallbladder, these stones act as strong attenuators for the ultrasound pulse reaching this depth. Therefore, the reflected intensity will be weak. Consequently, at this time, when the signal is weak, it is displayed on the grayscale as dark or black, unlike the high intensity, which is displayed as bright. So it will be incomparable with the neighbors or with the dips at the same depth, which will have shadowing. This shadowing is displayed in bright color. So at the same depth, I have shadowing. This is what is called acoustic shadowing. The solution to this issue is to change the angle of the probe to take, for example, a different angle so that it can start to visualize this area containing acoustic shadowing more clearly. So, the nature of the condition inside the gallbladder, is it something calcified or is it something else? You can also identify it from the artifact. The artifact here gives you additional information about the diagnosis that you have a calcified spot, so you confirm that it is a strong attenuator and it created acoustic shadowing. If it didn't create acoustic shadowing, for example, then it would be something else or have different tissue characteristics. The same idea applies here. This area is considered the hypoechoic band that is present. Here, I have the gallbladder stone, and it's the same idea and topic. Here, we are also talking about the gallbladder, and there is a gallbladder stone. The same concept applies. I created this area in this way. Here is the gallbladder, and as you can see the dark area, which is where the stone is clearly visible to the eye. This is very clear, and here is the gallbladder again, and here are the calcifications in this particular area. Now, as we proceed, let's move on to the second point, which is acoustic enhancement. What does acoustic enhancement mean? It means the opposite. You had a strong sound attenuator. In acoustic shadowing, here you have a weak attenuator, which means that the ultrasound pulse will pass through a region where the tissue has less attenuation compared to the neighboring tissues surrounding it. In this particular scenario, the signal or ultrasound pulse does not experience significant attenuation here, so it continues to the area beyond the weak attenuator, thereby giving you a strong reflected signal. This makes it a hyperechoic signal, which is what we call acoustic enhancement. For example, as we see here, there is a weak attenuator, and here is the signal that it sends, and the sound pulses have passed through and returned strong because they did not experience significant attenuation compared to the others that are moving through the rest of the area. Therefore, as a result, it appears in white on the image. Here is indeed the same thing. This is such as, for instance, in fluid field structure. The fluid field structure is considered a weak attenuator for ultrasound pulses. It does not cause significant attenuation, leading to high reflection, and thus providing the acoustic enhancement we were discussing. Of course, it can change by, for example, using a different angle. You can also understand the same idea I was talking about, or you can know what it represents. Is it a fluid field structure, or is there calcification due to the acoustic shadowing that will occur? Is it acoustic enhancement or acoustic shadowing? Depending on whether it gives you a hyperechoic signal or a hypoechoic signal, you can determine the nature of your findings. Of course, here is Goldbrother stone, which relates to acoustic shadowing. And here, regarding acoustic enhancement, for example, is the ovarian cyst. And here is brightness, which indicates the ovaries, as the ovarian cyst is considered weak attenuation. There are associations related to multiplication of echogenicity, specifically multiplication of echogenicity. I have 4 associations, one of which is called comet tail, something called. The 4 aspects are related to the reflection process, as we mentioned in the previous video. One aspect involves high attenuation, while another involves appropriate attenuation. If strong attenuation occurs, this is considered acoustic shadowing. If strong attenuation occurs, this is acoustic enhancement. We also learned about the different types of enhancement for proper enhancement. Okay, what are we essentially dealing with It means that when something experiences a transition, like we said, it starts to create a reflection. This reflection begins to occur in relation to